Hello, my name is Justin Clark, and I work with Adolescent Health Working Group, a nonprofit organization based in San Francisco, California. We are a coalition of youth, caregivers, and adolescent providers in the public and private sectors, and we seek to increase the capacity of service providers to better support youth ages 12 to 24 by offering providers training opportunities, innovative resources, and direct community engagements. This video interview series is to help inform folks on the variety of ways that nonprofits, public agencies, and providers support the health and safety of young people. And as an organization that is dedicated to bringing folks together, Adolescent Health Working Group will use this series to help elevate and share the voices of experts, leaders, and young people. And so we are excited to be joined by Suzan Kotch. Suzan is the Director of Social Work at East Bay Children's Law Offices, a nonprofit based in Oakland, California. East Bay Children's Law Offices represents children and youth brought to juvenile dependency courts because they have been abused or neglected, children in probate guardianship proceedings, and provide community-based advocacy for resources and education. Before joining the organization as the Director of Social Work, Suzan worked for Alameda County on a variety of programs, including family reunification, services enhancing early development, and adoptions. And she previously worked in a group home as a family preservation social worker and as a field work instructor for social work interns. Suzan, thank you very much for joining us today.
Thank you.
So I gave a bit of an introduction for East Bay Children's Law Office and your work, but would you mind sharing a bit more about your work and what East Bay Children's Law Office does?
Sure. So we represent all the foster kids in Alameda County, 0 to 21 years old. And we also have a small practice that represents kids in our probate guardianship team. So we're a multidisciplinary practice. We have lawyers, social workers, case managers, and we have some specialty lawyers that deal with education, mental health, and early childhood that work as part of our team as well. So we take a collaborative team approach to serving the youth that we represent in court.
Great. So one of the reasons we wanted to chat today was just trying to get a better sense of, as we're recording this, I'm kind of in the midst of COVID-19, and just kind of wanted to get a sense of how COVID-19 is affecting the juvenile dependency court and kind of the foster care system and what you're seeing there.
Well, it's impacted every facet of the work we do and the lives of the kids we serve. I mean, first of all, the courts have been closed for a long period of time. They're just starting to open up on a limited basis in a virtual way, but that's really delayed a lot of important decisions for the children and the youth that we serve. Kids aren't getting adopted, kids are not getting returned to their parents. Important decisions aren't being made and are on hold, and that can be really stressful for kids and their caregivers. The other big way is that visitation for our youth has been largely disrupted. So a lot of our youth were having regular visitation with parents, relatives, or siblings, and the shelter-in-place order has suspended most of that visitation or moved it, largely to video or phone visits. And that, again, has really been stressful for youth because it's cutting them off from their biological family. And so that's been really hard. We've had college students that had nowhere to go when their dorms were closed. We have a lot of our kids who receive IEPs. They have special education issues or developmental services, and a lot of those are just not happening right now. They're not getting the services that they need. And falling farther behind. A lot of our kids, they depended on therapy and behavioral support services that have either stopped or moved online and become much more limited. There are some positives, I would say, just in terms of like the way that government has responded to youth in foster care. There's been some increase in foster payments and CalFresh payments. There's been a temporary suspension of dismissing 21-year-olds from the system so they can continue to receive housing support. So those are positives, but I would also say there's been a lot of placement disruption. So a lot of our kids in foster homes or group homes are moving more frequently because caregivers either can't manage behaviors or are struggling with childcare issues or parent-child conflict with kids that are home all day, or don't want to comply with some of the visitation orders that are starting to happen.
That is a lot of different ways. You mentioned the kind of increase in the kind of video conferencing, and I saw that on something that you wrote on the East Mitchellville office website. Was that I apologize for kind of quoting something you wrote back to you, but you had said, by nature, social workers thrive on in-person contact with clients. How are you adopting to virtual visits, and do you have any advice for providers and professionals who work with young people who may not be used to that and are trying to kind of adapt to the current situation?
You know, it's hard. I think it's not our nature to be seeing kids across a screen. It's really hard to get a good interview of a child of any age. There's issues with confidentiality. You know, can children be in spaces that are really private? You know, a lot of our interviews would happen at school or out in the community so that kids could have confidential space to talk to their lawyers or the social workers that represent their lawyers. So that's been hard because they're stuck at home, and you know, who knows who's listening to that phone call or to that Zoom. So that's been, I think, one of the primary challenges. And then, you know, just keeping kids engaged on the screen has been hard. So we've been trying everything. You know, with little kids, we use puppets and toys to kind of keep them involved. We play games. I tell jokes with kids. I do a lot of kind of like icebreaker type stuff. With older teens, we've switched a lot to texting because that's one of the ways they feel most comfortable and also can be more confidential for them, you know, than having a voice conversation where other people can hear them. So we've done a lot of that. We're starting to think about, you know, doing some distance visits with our older kids where we can take them out, you know, on a walk or somewhere in the neighborhood that's, you know, safe, but also can provide us with maybe a little bit of a more personable interview. The one positive thing I would say is some of our youth are harder, they're easier to find right now. They're home more. And so, you know, we spent a lot of time, especially with our non-minor dependents, sort of trying to find them, trying to find a good time to talk to them. And so the one positive thing is I think we're finding some of our kids are just more available to talk to us right now.
That is a positive. So something that you had mentioned sort of in the last two things that you shared was around some of the ways that COVID-19 is making some of the conversations harder and some of the stress and anxiety that young people have. Are there things that you think that caseworkers and child advocates and judges and others who are working with children and young people, are there things that they can do to help kind of reduce the stress and anxiety that young folks may be feeling as they either try to navigate the juvenile dependency court or sort of their own situation at home, or even just kind of generally everything that's happening with the pandemic?
Sure. I mean, I think the biggest thing that we've really done is really try to advocate for kids to continue getting whatever services they were getting that were helpful before in whatever way we can. So a lot of times that's making sure that therapy is moving online. That's trying to advocate for educational services to be provided at home. And it's really about trying to keep kids connected to their families and their relatives any way we can. And a lot of times that's really, you know, sometimes it's even helping, you know, a caregiver install Zoom on their phone so that the kid can talk to their mom, or, you know, sometimes it's talking people through the tech that's involved. But it's really trying to advocate for, okay, if it's not realistic to see parents in person, how do we maintain that contact? And I think there's sort of this de facto, everything is shut down, we're just suspending everything. And I don't think that's necessarily needs to be true for our kids. Our kids are some of the most vulnerable kids out there. So what can we do to provide the services they need, you know, in whatever way we can. And right now, I mean, we're in the process of trying to work with the child welfare workers in the courts to figure out how can we let kids see their parents and their siblings in ways that are safe? How can we be creative to think outside the box for what a visit might look like right now? Can it be in the park? You know, can it be a distance visit for an older child? So I think that's really important, is just to get creative and to just really advocate that these things need to keep happening for youth, because there's been so many disruptions for them. And we can't let everything stop now, because they're really vulnerable and they need these services and support and these connections to their community. And we need to hear what they want. You know, what are they wanting to do? So really listening to youth right now too. What do they need? How are they doing? And I think one of the biggest things people can do is just give youth space to talk about how they're feeling and what's coming up for them right now and what they're struggling with and what's going well for them. You know, some of our kids are actually enjoying the break from in-person school and those sort of things. So just being able to hear what is working and isn't working for youth. And they need us to be patient right now, because it's hard. I mean, behavior for all kids is hard, and especially kids who have trauma, you know, and who are struggling, it's really hard. So just really being patient, having empathy, seeing behaviors as part of the larger picture of what's going on in the world right now and what their history and their experiences have been. And then I think, you know, we all have to be looking at the big picture too. How do we advocate for policies and for remedies to some of what's going on? So, I mean, we're looking at what we can do in the courts to try to make sure that reunification services get extended to families that were impacted by this. And, you know, we've been advocating for policy issues, you know, in terms of funding and things like that. So just really trying to look at the bigger picture as well as the story.
So there may be folks who are watching this video who are kind of new to this issue and you know, obviously haven't engaged in this work on a day-to-day basis as you have, but understand the importance right now, the work that you're doing of trying to provide, you mentioned in your last answer, kind of provide the things that young people need any way that they can. Are there ways that individuals who are kind of not doing this work every day, that they can help some of the young people that you work with?
Sure. I mean, there's lots of organizations out there doing this work that are being impacted by funding cuts and cuts from grants and foundations right now. So giving to organizations like ours, there's ways to get involved. CASA, which is court-appointed special advocates, they're still recruiting and training mentors right now. So if you're interested in supporting foster youth, you know, on an individual basis, you can absolutely look into that. And they really need people right now. Foster parents are desperately needed right now because there's a major shortage. So if that's something you've been thinking about, now's the time. They're still licensing and approving folks to be foster caregivers. And then, you know, I always tell people there's foster kids and foster parents and caregivers, relative caregivers in your community everywhere. A lot of us know them through our church or through the school. So how do we support those folks in caring for these kids and youth? And maybe that's bringing a meal, maybe that's offering to grocery shop for them, because caregivers are really stressed out right now and they have a lot on their plate. So if there's ways that we can support those folks in your community, you know, that's actually supporting the youth by supporting the caregivers and taking some things off of their plate right now. One of the biggest ways I've been encouraging people who want to help and donate is we're really trying to make sure all of our youth are connected digitally. And that's an issue that foster kids often have. They don't have their own devices, or they live in homes that may not have Wi-Fi or adequate Wi-Fi. So there's a lot of organizations folks can donate to make sure that foster youth are getting laptops and hotspots and, you know, tablets and things like that, because not only does it help them stay connected to school and not fall further behind, but that's their connection to their family a lot of times right now, you know, video visits or phone calls, how they stay in touch with mom or dad or sisters or brothers or grandmas.
Great. So the final question for you is a little bit different, and just that's because we're recording this during a stressful period of time, as I mentioned, due to COVID-19. Is there anything that you personally are really enjoying right now? It can be a book, a musical artist, a TV show, anything that has kind of lifted your spirits and helped you during a stressful time?
I have two little kids, so we've been getting outside a lot and doing a lot of hikes. And that's been really, really helpful to me and really helpful to them and letting their energy out. And it's just been fun watching them be able to explore new places and, try new things and feel that accomplishment of getting to the top of a hill. So that's been a lot of fun.
Awesome. That is great. So, Susan, thank you so much for joining us today. We appreciate your time and kind of the opportunity just to learn more about your work. And if you would like to learn more about East Bay Children's Law offices, please visit their website at ebclo.org. And we will include a link to that in the video description, so you can look for that if that's easier. And also, if you want to learn more about Adolescent Health Working Group, you can visit our website at AHWG.org. So thank you so much for joining us. Thank you everyone out there for watching, and wishing you all good health and take care.
Thank you.